please tell me who are these 9 dentists who are recommending.
Do you think most people brush their teeth the wrong way, or is there any right way we should brush our teeth?
Definitely, every patient needs a different method to brush.
अभी काफी ad आती है दांतों में झंझनाहट.
So basically, sensitivity can be due to many reasons.
Okay. So is it necessary that we get instant attention to that small cavity, or when it gets serious only?
Ideally, yes.
Okay. I guess either way is anything you see or notice, you should get it treated as soon as possible.
One, basically make sure that any toothpaste you buy should have fluoride.
Fluoride. Okay, fluoride should be there. That's one checklist.
Fluoride is actually anti-cavity.
Okay,
it
that's
prevents your
anti-cavity.
cavity. We are not wrong on that part because they have eaten that healthy food with those teeth. Right now, our food is all processed. How will I get a guarantee that patient is going to wear it?
Yeah, exactly. They might some
just remove it, and
yeah.
they might forget to wear it back.
Yeah, I think that is also something people avoid.
Yeah.
कि जब दर्द हुआ तब जाएंगे.
मुझे कुछ प्रॉब्लम नहीं है, मैं क्यों जाऊँ? But sometimes it's not about the problem, it's about how well you are maintaining the treatment that is done.
Correct. Hello everyone and welcome back to my channel. Today I'm joined by Dr. Chahana Shah, who is a dentist. So today we're going to be learning more about how to have a better oral hygiene. We'll talk more about her experiences and dentistry overall. Welcome Chahana, how are you?
Hi, I'm fine. Thank you for having me here.
Yeah.
How have you been?
Yeah, I'm good. Thank you for asking that. बहुत ज़्यादा लोग नहीं पूछते हो, but yeah. So once again, thank you for being my guest. And oral hygiene has been something I feel a lot of people don't take maybe seriously in their day-to-day lives, but आगे जाके जब problem आती है, it's a very major problem, right? So I think this is something education is required for, right?
Definitely. In fact, a lot of people have become more aware with the dental hygiene nowadays.
Yeah, exactly. And that is something that's needed as well.
Yeah,
right?
Definitely. It has
Amazing.
been improved over the past decade.
Amazing. So, we'll definitely come to the hygiene and how to have a better oral health. But I would like to start by your experiences. It's been almost 8 years or maybe more that you've been a dentist. How is your experience there?
It's fantastic.
Okay.
It's just each patient is new, each person is new. There are different things with every person. It's not that if there's something with you, the same thing won't be with the different person. There's always different things you learn. So it's been awesome.
So something new you get to explore
every time.
That's
amazing. Not all teeth are same. Only the shape and morphology, to some extent it is, but not entirely.
That's amazing. That's a very dynamic career path, I guess. Yeah.
100%.
Amazing. So you said every patient is different. What would be one patient story that is always there with you can never forget?
So basically, there was a middle-aged woman who had come to me almost 3-4 years back.
Okay.
She hadn't smiled for a long time because her front tooth was discolored and broken.
Okay.
And she had just come to fix it, and she was very skeptical of doing that because she was very afraid of the dental treatment. As usual, the patients are afraid of all the dental treatment. And then we helped her improve her smile and everything. And then she was pretty much happy. The thing that made me happy was seeing her gain her confidence back, smiling.
Correct.
Maybe that must have given her some boost psychologically somewhere.
So you literally made her smile again.
Yeah. It was not more about smile, it was about her confidence.
Yeah, exactly.
Maybe, I don't know, she might not be even speaking that openly if she was not confident with that smile.
Correct.
Maybe that must have been one more plus point of her speaking again.
That's amazing. Well, that's a very great story, right? So till now, I guess you had been working with other dentists in other clinics or hospitals. Now you're opening your own clinic.
Yes.
So congratulations on that.
Thank you so much.
So tell me more about your own clinic. What are your plans with it and how do you plan to take it forward?
So basically my most basic thing is I want to keep all treatments in-house. And I need patients to have that trust and loyalty with that patient that any advice is always going to be 100% true. And they can just come in and get all the dental treatment done under a single roof. That's the plan. Instead of going somewhere else for other treatment somewhere else.
Correct.
everything combined under one roof.
Yeah,
is
काफी
the
बार
plan.
ऐसा होता है कि like for a certain treatment आपको अलग जगह जाना
Yes.
भेजता है इधर के लिए, so it's
So
like sort of
majorly everything
yeah,
under one roof is the plan.
that's very great.
We can
So,
call in consultants and everything
correct,
and get it
correct.
done under one roof, and that also to make it a good work is the priority.
Correct,
Making
correct.
sure the science and technology are well combined with artistry.
That's amazing. So sort of a one-stop solution.
Maybe.
Good
Like
for patients.
overall, yes.
Yeah.
90-95% everything should be covered.
That's amazing. That's amazing. Well, again, congratulations
Thank
on
you.
that. I must be one of the patients someday, I guess.
Most welcome.
Yeah.
That time I'll be asking you questions.
Okay. Well, why not? So, about questions, it has been great learning about your experiences and your future plans. But let's talk about, some tips and tricks that you can give as a dentist to people or, anyone who's viewing this. We've always heard this, brushing teeth twice a day is something that's necessary. But I think a lot of people don't do that. So, is it really necessary कि अपने को 2 बार brush करने चाहिए daily?
100%.
Okay. Why so?
Why? Nice question. So basically the thing is when you eat entire day, at night, once you clean your teeth, your mouth is free of bacteria. I won't say free of bacteria, but at least the amount of bacteria reduces. So the night activity, if you don't brush, the activity of bacteria increases in the entire night. And when you brush in the morning, it's not efficiently brushed.
Okay.
Or let me phrase it that way. You brush in the night to keep your teeth.
Okay.
You brush in the morning to keep your friends.
Okay, that's amazing. Very well put. Yeah. So definitely, I do brush twice by the way.
That's awesome. You should make sure that people around you brush twice daily.
So spreading awareness about it, right?
Definitely.
So, talking about people, you have interacted with multiple patients over past 8-9 years. Do you think most people brush their teeth the wrong way, or is there any right way we should brush our teeth?
Definitely, every patient needs a different method to brush. Like for me, some other method would work. For you, some other. It depends on the condition, but basic steps remain the same. That while brushing, make sure your gums, the food from your gums is also, the food between your gums and the tooth interface is also cleared out.
Okay.
And the brush reaches the last tooth and it removes the food particles stuck there. Basic things need to be.
Mostly I think people do it in a hurry, so kafi kuch reh jata hoga.
So there are many things like that. Like people don't brush for 2 minutes, like it said, ideally 2 minutes.
Okay, 2 minutes.
But people are in a rush. They use hard toothbrush instead of a soft bristle. So that is also one of the things. Then also people use this, forget to use tongue scraper. And few people have this misconception that you just do mouthwash, you squish, and then you are done. You don't need to do brushing. That is absolutely false.
Okay.
You need to do brushing. Mouthwash is just an add-on procedure, but it's not a substitute to brushing and flossing.
Okay, got it. That's something new I learned. Right. You talked about types of brush, like soft bristle, hard bristle. There is this thing between manual toothbrush and electric toothbrush. A lot of people are migrating to electric toothbrush because I think it is sort of a trend right now in the market. You don't have to move your hand a lot. So what is better, electric toothbrush or a manual traditional toothbrush?
Both has its own pros and cons.
Okay.
So between electric and manual, we can anytime choose for electric because it's more efficient. It is a set timer of 2 minutes.
Okay.
And only the cons of it is just that carrying it, because it's a little heavier than the normal manual, and charging it or using a battery. But if you see it in a long way, like everyone needs to invest in an electric brush, then I would say no. Even manual will work efficiently if you brush properly and you follow that basic protocols like changing a brush after 3 months and everything, using soft bristles so that it doesn't harm your teeth, and you brush 2 minutes compulsory.
So that is the benchmark for brushing, you can say. Right, that's amazing.
So both are fine in its own way. Yeah, but electric toothbrush are more glorified nowadays.
Yeah. So that's one thing. Yeah, got it. So earlier you said a mouthwash can be part of a routine, but it cannot be a replacement. But even if we see mouthwash as a part of routine, is it necessary or should it be optional?
It depends. Like if you have certain issues, then you can do it for some time. Like if you have some gum related issues, we usually, so I'm not taking the names, but we usually recommend any mouthwash particular that has to be done for that particular time only,
Okay.
not prolonged, because sometimes those when we prescribe might lead to staining or something like that in the long term use. So Colgate plaques and everything is good for your own mental health and for the minty flavor. But if you are thinking of protecting your teeth, then brushing and flossing.
Okay, got it. Something again adding on to my list, right? So, talking further, like, we're talking about some problems and some issues that people tend to ignore or maybe like, not put a lot of attention to. अभी काफी ad आती है दांतों में झंझनाहट, like, he was
Sensitivity.
right. Sensitivity is something I think a lot of people face. Even to an extent, I used to have that sensitivity. Anything cold or hot I have, like, I get that feeling in my tooth. So, and like, for a major part of my life, I had ignored it. So do you think like, it's something that is okay that you can live with it, or should it be like, getting that instant attention case ko cure karna chahiye?
So basically, sensitivity can be due to many reasons.
Okay.
So if sensitivity is like the first marker point, if you get sensitivity, then you should just expect there's something wrong either with the tooth, the enamel surface, the topmost layer surface is little eroded, has become thin, or there's some caries, or there's beginning of caries, or there's some problem with your gums. That's just the beginning of it. So it's very good to address it as you get it, and just get it to know that if that can be done, treated now or not, because a stitch in time saves 9. Like,
Yeah.
so that is how it is.
So that's about it. Like, it's better to cure it rather than like, letting it prolong.
Yes.
Got it. So I think talking about cavity as well, right? There is some small black marking that you have on your like, teeth, any teeth, I guess. So is it necessary that we get it instant attention to that small cavity, or like, when it gets serious only?
Ideally, yes.
Okay.
Otherwise, eventually what happens, that cavity goes into root canal treatment. Root canal, if not treated, then also it might lead to extraction, implants.
Okay.
You never know. Okay. It's just a small thing that just goes ahead, and it is usually irreversible.
Okay.
Cavity is irreversible.
So once it's there, you cannot like, get back to your original teeth.
No.
You need to
either you just remove it and get it filled. That is the best option. If not, then wait for it to form into the go for a root canal.
Okay. So I guess either ways, like, anything you see or notice, you should get it treated as soon as possible.
Once you see that there is some dust here, you don't address that dust.
Yeah.
It will just keep on accumulating.
Correct. That way. Quite logical, right? Yeah. So again, talking about something similar, bleeding gums, right? When you brush or maybe like, you eat something hard, you bleed from your gums as well. So some maybe like, I've heard this from some people that it's normal, like, it's a routine thing. You don't need to worry a lot about it. So why does this happen? And like, what's the
So basically
thing?
Bleeding gums are sometimes very harmful.
Okay.
Harmful as in not harmful, but it's a sign that you need to take care of it, because what happens, there's something called as gingivitis and periodontitis.
Okay.
So that is just the beginning of gingivitis or periodontitis. You just bleed. It's just you don't get any symptoms or sign unless it becomes worse. So bleeding gums are the first, what do you say, thing that you see in your mouth.
First symptom.
First symptom, maybe. Yeah. But you never know how much depth it has. Also, sometimes it can be a possibility while brushing, you just hit your brush somewhere. And that can also be a possibility. Absolutely. Or sometimes you might get bleeding. But if it is prolonged for 2-3 days and if you find it weird, then you should address it as soon as possible.
Now, you mentioned a lot of jargons related to dentistry, right? So, what are some basic things about teeth that people should know? Like, for example, these are called incisors, right? Like the foreign teeth. So, some basic things like, people should know about dentistry or their teeth.
Teeth are also very important. It is very much important because teeth, if you don't chew food, that is the first thing food that goes in your mouth, if you don't chew properly into a bolus and you just swallow it, it will lead to your stomach issues over the period of time.
Correct.
And every issue starts with stomach. Like there's a saying, they say it that way. So teeth are very important. So don't ignore it. I have 32 teeth, so let one go. No. God has given you different shapes and everything of the different teeth, so that they all have a particular function to carry.
Correct. So that's
like you said, incisors are used for biting, canines are used for tearing, and molars are used for crushing.
Correct. So that's like basic knowledge that people should know. Amazing. Yeah. As rightly said, people tend to ignore it, but it's not something you should ignore. But that's about application. If you talk about aesthetics, right? A lot of people want white teeth, white as milk. But a lot of times I've heard that real color of teeth is a bit yellowish. So what's the truth? Is it yellowish, or should people chase whiteness?
It is yellowish, and yellow teeth are also equally healthy if it is not the stain.
Okay.
But sometimes it makes people conscious, like yellow teeth, smiling, talking, it makes people conscious. So for that reason, they can go for any whitening or veneer or crown or anything. But if you think if it's not healthy or if it's not right, it's false. It is healthy.
Okay.
Yellow teeth are healthy.
So even yellow teeth are healthy.
So basically, yellow color internally is because our enamel, the first layer, enamel dentine pulp. So enamel is white, translucent.
Correct.
And dentine is little yellowish.
Okay.
So the color of dentine is what comes on the enamel.
Okay.
Because it's a translucent thing.
Correct.
So if your enamel is thin or something, even that can be one of the reasons why you get more yellowness.
Okay.
Can be one of the reasons.
Okay.
Sometimes stains, turmeric stains, especially in India.
Okay, healthy. Correct.
Yeah.
But as you said, it's supposed to be natural. Then right now, there is a lot of hype in market about purple whitening lotion or purple whitening cream, like some companies.
So basically, purple whitening is very much in nowadays. Like you open Instagram or any.
Yeah, it's everywhere.
It's everywhere. So basically, it's just an optical illusion.
Okay.
The color white and purple are exactly apart. So when you do it for temporary, it gives you whiteness. It is not long lasting.
So it's not sustainable.
It's not sustainable. Like the whitening procedures, that is the peroxide ones that we do it in clinic, it is not that effective.
Okay.
To that extent.
So how long does it last? Like if I get like white cream, how long does it last?
The purple one?
Yeah.
1 or 2 hours, 3 hours.
Oh, 1 to 2 hours.
Depends if you don't eat anything.
Okay.
It is just an optical illusion.
So there is no really point of it, is it?
Maybe if you just want to go for a quick party and where you don't want to eat and you don't have time for an appointment or whatever, you can do it. But
not
sort
of a quick fix.
Yeah, but not for a long-term solution thing.
But let's ultimately that cream or whatever lotion is, it gets digested, right? Some part of it.
No, you don't keep it on.
Okay, then you gargle it out.
Yeah.
Okay.
There is nothing that goes inside. Even the treatment that we do in clinic, it goes out.
So does it affect teeth in a negative way if people do it?
There are not much studies. There are not much studies on it yet. But let's see.
Yeah.
Because whitening and everything, like we do in clinic, whitening everything, it is good if you do it occasionally for some functions like weddings or something. But if you do it regularly, then it actually harms your enamel.
Okay.
To some extent, it has peroxide compounds, so it does harm your enamel in long term.
Correct.
So you do it, but not that frequently.
In a limit.
In a limit. If there's a wedding or something,
then that's
get
fine.
it done.
Got it. Great. So, as a dentist, what are some toothpaste that you would recommend? We see a lot of ads. 9 out of 10 dentists recommend this, but as a unbiased opinion, as someone who's really wants to help people to choose something right, what would be a right choice?
Please tell me who are these 9 dentists who are recommending. So basically, make sure that any toothpaste you buy should have fluoride.
Fluoride. Okay, fluoride should be there. That's one checklist.
Fluoride is actually anti-cavity.
Okay,
it prevents your cavity formation. The rest all is fine. Avoid herbals.
Okay, why? Why not
because
herbals?
it is good over a long period of time. Sorry, it is not good over a long period of time
Okay,
because it has
no.
abrasive particles that, what do you say? Uh, makes
Brushes
it
of the enamel.
enamel. Yeah, that makes your enamel rough and
Okay.
brittle. Like if it continuously there's abrasive particles rubs on your enamel, then it becomes brittle.
Correct.
So avoid herbal for a long term because it has larger abrasive particles which harm your teeth. In
You know, a
the
lot
long
of
run.
senior citizens have that perception that, oh, this is herbal Ayurvedic. I'll go for
Yeah,
it, yeah.
but the thing is, they have been eating healthy. They do not have so much pollution and everything. So there's a lot of lifestyle changes and everything that matters in this thing. I have heard people saying that I've used neem twigs
Yeah. Even our.
and my teeth were so good.
Yeah,
And
exactly.
everything. So we are not wrong on their part because they have eaten that healthy food with those teeth. Right now, our food is all processed.
Correct. Very true. So do you think, like, the toothpastes which are heavily marketed in the like, in on advertisements or somewhere, they are not really that good?
Depends again. Sometimes we prescribe toothpaste on the need of the patient. Like if you have sensitivity, we'll give you a toothpaste which
cures that,
which helps you with sensitivity. If you have like gum
Bleeding
issues,
from,
we give you a toothpaste or something which will help you with that.
Correct. So case to case it differs.
Otherwise, in general, you can use any toothpaste which is containing fluoride.
Okay, that's like the major point. Like, read the label, fluoride, yes, then okay, bye.
Yeah.
Got it. That's something new that I learned, right? I never read labels for toothpaste earlier.
Because it is anti-cavity, and our main purpose of using it is just to prevent the cavity.
And then one more thing, like, whatever toothpaste we choose, I've also heard this, like, the amount of toothpaste that we put on a brush, that also depends. A lot of people, like, just put layers and layers, and some people just, like, put a tiny dot. So what's the ideal amount of toothpaste?
Pea-sized.
Pea-sized. Okay.
Yes. So basically, long back, I won't name the company, but the company had done that full
that advertisement we see
wave of that. So people with that advertisement only, they started, that was a marketing strategy. So people will use more toothpaste, it will get finished fast, buy a new one.
Okay.
It was their marketing strategy. Ideally,
तो लोग ज़्यादा डालेंगे तो जल्दी खत्म होगा तो जल्दी.
So if you've seen all their ads, all ads have this big wave of toothpaste coming out. That is a marketing strategy.
Wow, debunking ads.
It is just a piece that you need.
Okay, so that much is enough.
Yeah.
Okay, that's again something. I think I am definitely using more than pea, but now
you can use a little bit more. That is fine, but so much more not needed. Not needed.
Great. Achha, one more thing. Like, I'm just asking out of personal experiences. A lot of people face problem with their wisdom tooth or wisdom teeth, right? And a lot of people say it's okay, you can, like, keep it, or some people say no, you should remove it as soon as, like, So what's the deal with wisdom tooth, or like what should be done?
So basically the thing is, if it is not harming you in any way, it is not affecting your other teeth, keep it as it is. But if you're getting pain or something and it is leading to caries in your adjacent tooth, please remove it.
Okay. So it depends. If it's causing some problem, then you should remove
definitely.
it.
If it's causing
Otherwise,
pain,
we can keep it.
Yeah.
Okay.
Doesn't matter. It is just a normal tooth. It's just with evaluation, our jaw sizes have shrunken.
Okay.
So, but teeth, then we used to have earlier 4 molars.
Okay.
We as in our ancestors.
Like our ancestors.
And it has reduced to 3.
Okay.
And now the future generation have 2 molars.
Okay.
So it is more like a vestigial, but it's not vestigial yet.
Okay. Got it. That's crazy.
Because
like,
the jaw sizes have shrunken, basically.
Yeah. Earlier it used to be big.
Yeah.
Great.
And also earlier you needed that because people used to eat a lot of raw food.
Raw meat and
raw food, everything raw. So they needed more chewing with that.
Okay.
With our processed food, I don't think we need that chewing.
Yeah, now it's everything like
I know people who eat bread every day. Like, they don't need that chewing
they
thing.
might not even use it all 4 molars either. But like, as you said, agar koi problem ho rahi hai wisdom teeth mein, then we should remove it. Yeah. Right? So I'm assuming there must be different procedures to remove it.
Yeah.
So what's the safest and the most painless way to remove your wisdom tooth?
See, there's no safest or painless way. Everything is safe
Okay.
because the dentistry has evolved drastically in over a decade. So you just go to a doctor, get yourself checked with X-ray and everything, CBCT if needed, and accordingly you plan a extraction procedure. Doctor, the dentist will guide you what is to be done. Eventually, that will be done. Make sure you follow the aftercare steps very properly.
Okay.
And take medicine on time.
So, there is this perception in people, yeah, dentist ke paas jana hai, they'll do some drilling in this. Everyone's sort of scared. But as you said, we have developed ke ab sab kuch painless and
Yeah, it is painless eventually because there are so many technologies that have come.
So it's good for people now. That's amazing. That's good to learn, removing my fear.
Yeah. Earlier there was not much of it. Now it is really good.
So, again, talking a bit more about our routine, about maintaining oral hygiene. In West, we see a lot of people floss their teeth, they put some ribbon in front between the spaces of their teeth and they remove that particles. And over here in India or Asian countries, I don't think there's a lot of culture about it. So is it really necessary that we should floss or is it optional?
No, flossing is compulsory.
Okay.
Because when you brush, it just removes your tartar, food particles from your front and back of your tooth. What about the food present in between your teeth? That is removed by a floss. So there are different flosses available in the market. The rope one, which is most commonly seen. Also, there's the water flosser.
Okay. So that must be from pressure.
Water pressure.
Okay.
It is just a jet spray of water.
Yeah.
And it will help you remove everything.
Those particles.
The tartar and everything.
Correct. Let's say someone is not flossing. So eventually some food particles might stick. So what happens? Let's say they're there for 10 hours, 12 hours.
So basically, usually 10 hours, 12 hours is normal because if you floss in the morning, by night it is 10 hours.
Yeah, definitely.
So you do it at night, it gets out. But eventually, if you don't floss at all, eventually you won't realize it now, but maybe after a few years or 10, 15 years, there'll be cavity formation in that area because the food is stuck there. The food is stuck there. If it's not removed, obviously it is going to have some bacterial activity going on in there.
Got it. So flossing is much more important than we think.
Especially at night, once a day, because it removes and it keeps your mouth clean and fresh.
Got it. Something I will add to my routine now.
Please do.
Yeah, thank you so much for free advice today. Right. One more thing, a lot of people have uneven teeth, right? And earlier childhood, people tend to get braces, but some people don't get braces, right? So, is it okay to have uneven teeth or should we get those braces and make it even?
Ideally, you should get it even with braces because what happens is with uneven teeth, there's uneven pressure on biting of food and everything. And also with age, your jaw size changes.
Okay.
The bone density and everything changes.
Correct.
So because of that also, your chewing efficiency changes. It might lead to more cavities. It might lead to more gum issues.
Okay.
So ideally, it is recommended that you should get your braces done or some aligners or whatever is more feasible in that particular case and get it done, get it aligned. So correct. Food particles that have been caught in between the teeth and everything reduces.
That is reduced to a good extent, I think, right? That's great. As you said, there are two things, braces and aligners, right? A lot of people, I think, avoid braces because ganda lagta hai, it's not looking good. And lately, invisible aligners is something that's booming, right? So between these two, which is more effective?
Braces.
Okay, braces. Right.
So basically, braces can deal with the most difficult of the case. That is most malaligned case and deep bite to a great extent and everything. Aligners usually target to mild to moderate cases.
Okay.
And the only good thing about aligners is it is transparent. You can wear it, you can remove it. But that is the worst thing because you don't get compliance from patient. How will I get a guarantee that patient is going to wear it?
Yeah, exactly. They might some
just remove it and they might forget to wear it back.
Yeah, that's a major issue.
Braces is something I know what will be the outcome after 2 years or two
Because
and a
you
half
like
years.
just screw it in there,
Yeah,
right?
exactly. If I'm going for braces, I know that it is going to take this much time to complete the procedure, and this is what I expect after 2 years or 2.5 years. But in aligners, I don't know that because I don't know if the patient is going to
Gonna wear it or
comply
not.
to it.
Yeah, that's a major
But
issue.
it is good. It is a nice invention and everything. If patient actually complies to it, then they are saved from the braces.
Okay. So it's up to the patient. If they're disciplined enough, they should go for
Yeah, but some cases don't permit aligners because
some extreme cases.
some extreme cases. So for that, our regular braces are
Great, great. Now talking about extreme cases, like I've heard this. Crooked teeth can also lead to headaches.
yes, it does.
How is that like related?
Your biting force changes.
Okay.
So there's a thing. Your teeth are aligned like this. Exactly, your teeth falls like this.
Like they're like a puzzle piece.
Puzzle piece.
Yeah.
So if it's crooked, if it's this, you bite on this.
Okay.
So you're biting continuously on this part instead of this part.
Correct. So due to that like nerves
your
can
jaw gets irritated. It gets inflamed over the long period of time. It starts with your jaw pain and then it migrates to your head.
That can be severe as well, right?
Yeah.
Wow. So, talking further, let's say you already gave a lot of tips, but there would be, let's say, you have to only give 3 dental tips to someone as a dentist. What would be those 3 tips be?
Brush twice.
Brush twice.
Don't forget your tongue cleaner.
Don't forget tongue cleaner and
go for your regular checkups.
Go for regular. I think that is also something like people avoid.
Yeah.
कि जब दर्द हुआ तब जाएंगे.
We tell after treatment, we tell patients, I see you after 3 months or see you after 6 months.
But they
don't turn up because मुझे कुछ problem नहीं है, मैं क्यों जाऊँ? But sometimes it's not about the problem, it's about how well you are maintaining the treatment that is done. Sometimes even the treatment that is done, if you're not maintaining it, that might require a little
some tweaking or some improvisation, right? Regular checkups is something people
very much
should
important
get done, right? Talking about teeth and all this stuff, it's said having chewing gum can also help in maintaining good oral hygiene.
Definitely, if it is sugar free.
If it is sugar free.
Xylitol or something is
Okay.
better. Because what happens, it removes the food particles that stuck on your teeth because of this chewing gum consistency.
Yeah.
Also, it leads to saliva formation.
More saliva formation.
Yes. So that helps the cleansing of teeth.
Okay.
But I recommend not to use it excessively because it might lead to this TMJ pain, the jaw pain, and eventually headaches. If you use it over excessively. Regularly, it is fine.
Okay. Normal usage is correct.
Sugar free.
Sugar free. That's the key point.
Because if you're using the sugar one, no use of sugar the gum because it's just getting stuck to your teeth.
Makes sense. As you said, some chewing gums can be good for teeth as it can help in naturally cleansing the teeth. What are some other foods that can help in maintaining good oral hygiene?
Food, I'll say fiber-rich food.
Fiber-rich food.
Our apples, fruits, everything, they have fiber that naturally helps to clean off the, like our roti, chapati when you eat. It actually helps you clean the sugary thing that's coated on your teeth.
Correct. So that's good. Fiber-rich food.
Fiber-rich food is important.
That's amazing. So we also talked about how teeth pain can eventually lead to headaches and stuff like that. So how does oral health or oral hygiene, I've also heard affects your heart health as well, or overall, body health as well? How is that connected?
So basically what happens, our mouth has a lot of blood vessels, and if your oral hygiene is not maintained good, there are a lot of bacteria and they directly enter your bloodstream via those blood vessels.
Okay.
And eventually they reach your heart.
Okay. So that way it can affect our heart health as well. That's very severe.
Yeah.
Right.
It is not that rarely, but it is rare.
Okay. It's rare, but regardless, people should take precautions.
Yes, absolutely.
That's amazing to know. Right. Okay, so Chahana will have some sort of a rapid fire now.
Okay.
Right. So What's one thing that you wish every patient knew?
Flossing is important.
Okay. What's the worst dental habit that you see almost every day?
Not cleaning your tongue.
What is the most overrated dental product?
Mouthwash.
What is the most underrated dental product?
Underrated regular checkup, but that's not a product.
That's a service. But regardless, I think we can consider, right? And lastly, one dental myth you want to bust right now.
I already busted one.
Already you busted a lot.
Dentists are not here to take money from people.
Hmm.
They are here to help you. We don't want you to come to us for small things, but when you come to us, we make sure that everything is treated at one go, and we want you to live a healthy life.
Correct.
So if you come with, when you have already your tooth has gone for a root canal, we'll have to do a root canal. It's not that something we are expensive. It's you who
It's not something you're selling.
Exactly.
Right.
It's you who had come late for the treatment to us.
So you're there to actually give proper guidance,
Exactly.
not just to make some
do
sales.
it. Exactly.
That's.
If you would have come it in the cavity stage, it would have actually charged you much less than what it actually charged you with the root canal.
So it's somewhere our fault that we.
Definitely.
Okay.
That small thing, I'll take a painkiller and it will be fine. Eventually, it is not reversible.
Correct.
So attention is needed.
Attention is needed. That's right.
The earliest.
Yeah. So I had a lot of questions and I asked them all if there's anything you want to share from your end, anything people should know or you want to let out, something like that.
Just follow the steps.
Just follow the steps. That's amazing.
Brush, floss, and brush, floss twice.
You're really enthusiastic about your profession, and that's very rarely I see in people that people really want to spread awareness or really into their profession. But that's really great to see, and I wish you all the best for your new clinic.
Thank you.
I'm definitely going to be there as a patient someday.
Definitely. Then I'm going to ask you questions.
Yeah, even if I'm not facing any problem, I'll come there for a regular check.
Definitely. Do come.
Yeah. Thank you so much, Chahana. This has been amazing, and I wish you all the best.
Thank you.